Hey guys, welcome to my channel. I am Vishakha. आज हम लोग brachial plexus के बारे में पढ़ें. So, brachial plexus. What is brachial plexus? Brachial plexus is a network of nerves which mainly supplies the upper limb muscles. Brachial plexus consists of root, trunk, divisions, cords and branches. There are 5 roots, 3 trunks, 6 divisions, 3 cords and main 5 branches. So short form is RTDCB to remember. So the roots of brachial plexus are C5, C6, C7, C8 and T1. C5 and C6 togetherly form upper trunk. C7 alone form middle trunk. C8 and T1 togetherly form lower trunk. So there are 3 trunks, upper trunk, middle trunk, lower trunk, which are made from 5 roots. Now we will come to divisions, where there are 6 divisions. So each trunk have 2 divisions. So the upper trunk has anterior divisions and posterior division, middle trunk has anterior division and posterior division, and the lower trunk has anterior division and posterior division. So there are total 6 divisions. Now we will go to cords. There are 3 cords. So anterior division of upper trunk and the anterior division of middle trunk togetherly form lateral cord. Now posterior division of all the 3 cords, which is the posterior division of upper trunk, posterior division of middle trunk and posterior division of lower trunk togetherly form posterior cord, which is denoted by blue color. And the anterior division of lower trunk alone forms the middle cord. So there are 3 cords, which are lateral cord, middle cord and posterior cord. Lateral cord is formed by anterior cord of anterior division of middle trunk and upper trunk. Posterior cord is formed by all the posterior divisions of all the 3 trunks, and middle cord is formed by anterior division of lower trunk. So we have roots, trunks, divisions, cords. Now there are 5 main branches. So what are the branches? We will look now. So the lateral cord. Lateral cord, we should remember the short form LML. Means the lateral cord has 3 branches, which is lateral pectoral nerve, which is L, M for musculocutaneous nerve and L for lateral root. Here are the 3 branches. One is for lateral pectoral nerve, one is for musculocutaneous nerve and one is the lateral root. Now we will come to middle cord. Middle cord gives 5 branches that are that is denoted by the short form MMMMU, that is 4MU. So there is branches, which is first is medial pectoral nerve, second and third is the arm and forearm. So which of the nerve, there is a common medial cutaneous nerve which supplies both the arm and forearm. So it is medial cutaneous nerve of arm and medial cutaneous nerve of forearm. So that there are 3M. First is medial cutaneous nerve, second is medial pectoral nerve, second is medial cutaneous nerve of arm, third is medial cutaneous nerve of forearm. Now the 4th M is of the medial root, which passes for the median nerve. Okay, so there are 4M. First one is medial pectoral nerve, second one is medial cutaneous nerve of arm, third one is medial cutaneous nerve of forearm, fourth one is medial root. Okay, and the last one is U, which is ulnar nerve. So here we got the 5 branches. Now let's come to posterior cord. The posterior cord gives branches with the short form of ulnar. So the U denotes for the supply to upper subscapular nerve. L denotes for the lower subscapular nerve. N denotes for the nerve to latissimus dorsi. A denotes to the axillary nerve and R denotes to the radial nerve. So there are 5 sub-branches of posterior cord, which are U for upper subscapular nerve, L for lower subscapular nerve, N for nerve to latissimus dorsi, A for the axillary nerve, and R for radial nerve. So this is the brachial plexus. Out of these branches, there are another branch which supplies the long thoracic muscle, which forms the long thoracic nerve. So the branches from C5, C6, C7, this togetherly combine and form a nerve which is the long thoracic nerve. Then one branch comes from C5 vertebrae which supplies a dorsal scapular nerve, which is a dorsal scapular nerve which supplies the dorsal scapular muscles. Then come the suprascapular nerve from the upper trunk which supplies the suprascapular muscle. Then comes the subclavius nerve which supplies the subclavius muscle of the clavius. Now, these are the total nerve which supplies in the brachial plexus. Now we will learn about the clinical anat, clinical aspects, what are the problems which we will go confront in if there is a problem in brachial plexus. So, this point here, it is called as a Erb's point. So why is it known as Erb's point? So Erb's point mainly means it is supplied by 6 nerves. That is, one nerve comes from C5, another nerve comes from C6. So there is 1, 2, 3 for the suprascapular nerve, 4 for the subclavius nerve, 5 for the anterior division, and 6 for the posterior division of upper trunk. So the combination of these 6 nerves, a combination of a point where all the six nerves combine is called as a Erb's point. So a damage to the Erb's point will cause a disease, a syndrome which is called as Erb's syndrome. So what is Erb's syndrome? Erb's paralysis. So Erb's paralysis, the muscles paralyzed mostly are biceps brachii, deltoid, brachialis and brachioradialis. So in this, the arm hangs by the side and is adducted and medially rotated. The forearm are extended and pronated. So disability of the muscles is abduction and lateral rotation of the arm at the shoulder joint. So this is known as Erb's paralysis. Now, if there is a damage at the lower trunk, it would cause Klump's palsy. It is another condition which is for the brachial plexus. So what is Klump's paralysis? It is mainly also called as a claw hand disorder. Claw hand is mainly due to unopposed action of the long flexors and extensors of the fingers. So this is the brachial plexus. This is a short summary of brachial plexus. That's all for today. Thank you for watching this video, and that's all the summary of brachial plexus. If you have any doubts, you can comment down in the comment section.